One of most common early signs of pregnancy is missed menstrual cycle. Doctors say most pregnancies last for about 280 days, which is somewhere around 40 weeks. To learn more about pregnancy stages, do's and don'ts, Dr. George Gwako, gynecologist at Precise Healthcare, joins me live via Skype from Nairobi, Kenya. Welcome, Dr. Gwako.
Thank you. Thank you for having me.
You're welcome. What should expectant mothers avoid in the first 13 weeks of pregnancy?
Thank you for the question. There are quite a number of things that pregnant women are supposed to avoid. So the first thing is exposure to drugs. That's over-the-counter drugs, things like cocaine, cigarette smoking, alcohol, and exposure to radiation, among other things. But those will be the key things that pregnant women are supposed to avoid.
Tell us about genetic tests for pregnant women and why this is important.
Thank you again for the question. So ordinarily, all pregnant women in the first trimester, as you had said, will be subjected to a number of tests that we call antenatal profiles. These include a hemogram to check for anemia. We screen for hepatitis B, syphilis, HIV, diabetes, and we do a urinalysis during each visit to rule out urinary tract infections, which are very common, preeclampsia and diabetes. Now, for genetic testing, it's usually reserved for a specific number of patients, especially those ones where you suspect they might be predisposed to getting conditions like Down syndrome if somebody is above age of 35, people with recurrent pregnancy losses, or patients with recurrent conditions like preeclampsia. So those ones will require additional tests on top of the ones that I just mentioned.
Should pregnant women be vaccinated, and what are the advantages and disadvantages of getting these shots?
Thank you again for the question. So there are quite a number of vaccines that are recommended during pregnancy, but 3 of them are very key. So the first one is the tetanus toxoid, which prevents pregnant women from getting tetanus, and also it protects their babies after delivery from getting tetanus. It's still common in especially low and middle income countries. The second vaccine that you ordinarily give is the flu vaccine, especially if, like in the tropics, if somebody will be pregnant around the flu season, which is around March to June. The third common vaccine that we are ordinarily starting to give is the COVID-19 booster vaccines. And this has been, it's something that has been brought into the fore, given the fact that studies showed that pregnant women are likely to have adverse perinatal outcomes if they get COVID-19 vaccine. So those will be the 3 common ones that we give.
And at what point do doctors decide a pregnant woman needs a C-section and not a normal delivery?
Thank you again for the question. So when pregnant ladies come to us antenatally, so one of the things we do is to have a delivery plan for them from the first visit. It's good to note that about 85% of women will have a normal delivery, about 15% will require cesarean section. Cesarean sections are of 2 types. They are the emergency cesarean deliveries and then elective cesarean deliveries. Emergency cesarean deliveries are the most common. The unfortunate thing is that most of those ones will not be able to anticipate. You wait for somebody to go into labor, maybe labor doesn't progress or the baby develops distress, then they require an emergency CS. For the elective ones, those are the ones we do before somebody goes into labor. The indications are few. Probably somebody who has had more than 2 cesarean deliveries and multiple uterine surgeries, for example, for uterine fibroids. What I'm trying to say is basically most of the times you will not be able to determine who is going to have a cesarean delivery and who is going to have a normal birth. But the odds are 85% for normal delivery versus 15%.